Just going to read the Zoom rules. The town of Littleton began conducting remote participation Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th, 2020. Since that time, unanticipated legal concerns relating to the open meeting law have been brought to our attention by the town clerk. Those concerns are supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to a board's public meeting. Chat is essentially running commentary that is occurring but is not moderated or followed by the chair. All participants and listeners may not be aware of comments being made because some participants join by phone and do not see these conversations. Other concern is conversations between residents within the chat, which are not incorporated in the public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you call in by phone, please use *6 to mute and unmute your phone. So that the meeting can occur in an orderly fashion, we ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you called in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute and state their name and address. After speaking, we request that the participant return their microphone back to mute. All right. So I think did you guys get the email from Janet saying that Ivan, Jim, and Chris Stoddard have not gotten a chance to discuss what's going on Ivy Road? So we're going to have to continue it. So can I get a motion to continue it to January 13th at 7 p.m.?
I'll make a motion to continue the hearings for Ivy Road and I don't remember the other.
Lake Drive
to January 13th.
Thanks, Kevin. So we'll go roll call. Kevin Baker.
Kevin Baker, yes.
Louise Nichols.
Louise Nichols, yes.
Mike Zeldin.
Mike Zeldin, yes.
Lisa Flanagan, yes. All right. So is Jim with us tonight?
I don't see him there. He's not in the audience.
Okay. So we do have, I don't know if anybody has any information, the COVID update. Mike, if you want to.
Yeah, yep. I have a little. All right.
Great.
The last count for Littleton is we're at 46 new cases. Our positivity rate is above, 3 to 4%. So we're even above the point we were right after Thanksgiving for positivity. I'm just going to give you Littleton's because the rest of the state is continuing a slower but nonetheless upward trend. And keep in mind, this is probably the remnants of the initial transmissions and infections and hospitalizations and all the rest that followed Thanksgiving. And we have yet to see, it's too early yet to see the, what I would call the direct Christmas, I'm in your house and I don't have a mask on events. But judging from the past, and we can only do that, unfortunately, we're probably, if not our next meeting, is our next meeting about 2 weeks from today, we might see the first signs of it then. Mm-hmm. Maybe for sure we'll see the second wave if there is one, and it could be delayed, but we'll see it probably. The other COVID update I have, if you want me to give it now,
sure.
All right, is, and since Lisa's already heard about this, I did some calculations and they were basically confirmed by Peter Holtz out at, he's the head of the operation at the University of in Minnesota, and he's actually an ace. So, I mean, compared to him, I'm sort of nobody, but he confirmed the basic numbers. So it gives you an idea where we're heading. This has to do with the vaccine. In order to get the entire country to the point where enough people are vaccinated so that it is really safe for people to walk around and resume almost normal life, pretty close to it, like we do with the flu, we needed 80% of the population has got to be vaccinated. 80%. So there's roughly 300 million of us, so you can do the calculation yourself. 80% of that, blah, blah, blah. At that rate, we need to start today and have people being vaccinated at a rate of 1 million people per day.
Wow.
We're nowhere near that. I think the most of it's given out since the announcement is 20 million people have been vaccinated, and that's how long it's taken. So it's not going to happen. And the problems, I'll be happy to go into it with you, but what we're looking at is probably living with the continued spread, the continued requirement for us to enforce whatever we have to do to keep the number of infections down and therefore deaths, probably into the fall. So let me repeat, we're looking at the fall.
I know, did you guys get the email from Jim saying that he still doesn't even know when and if first responders will be vaccinated on the 20th? Yep.
Yeah, and again, these are just facts on the ground. The supply of vaccines is not the issue as much because all the companies, whether it's Moderna, Pfizer, and now AstraZeneca and their partners are in the UK. Between the 2 or 3 of them, that production is not an issue. Making this stuff is straightforward. There are issues with the Pfizer vaccine because it needs special refrigeration that we won't face with Moderna. But the real problem is failure to plan what I call whether you want to call it the last 10 miles or the last mile, is even if the vaccine came here in sufficient quantities, what I mean into our district, not just Littleton, but our, let's say 495, there is nothing in place, no infrastructure. Our healthcare system does not have in any shape or form the ability to deliver at a rate of 1 million doses a day. So even though, one of my favorite 9 places is CVS and, all the other outlets that would be public outlets and the practices that are around, our healthcare system, being mainly private, is highly fragmented and incapable of doing anything at this level. Incapable of doing anything at this level. So asking the states, even Massachusetts or New York or even California could probably just barely get there. We would have a greater difficulty because we have so many competing interests here in the state. But it's going to be very difficult without direct federal participation, not only with funds, but also resources, setting up what we'll call very large and efficiently run distribution centers. That is where you walk in and get your shot. Then you have to sit for at least maybe half an hour because someone has to say, okay, you're okay, because the rare case of an immediate reaction is not trivial. You don't want those people walking, driving, or doing anything. There's a responsibility here for even the 1 in several million that may have an effect. So there's a lot involved here, including personnel. We just don't have that as built into our medical or healthcare system. So it has to be put together and invented because it does not exist, and the executive branch up to this point has been conspicuous by its absence and incompetence. And I'll just leave it at that. I'm speaking as a health board member. I mean, Jim could run a better operation. Let's put it that way.
discouraging, the fact that this is what we've been waiting for and there's no plan in place to implement it. So, yeah.
Well, there eventually will, I'm sure there will be a plan put into place sooner rather than later. I think most of the stuff, the other piece of this, of course, is the economic impact. I just don't, I do know that the Baker administration has worked very hard to assist small businesses and maybe even succeeded, but it's going to take a toll on the state economically, and therefore it's going to reverberate back on the health of the citizenry. So I have no good news tonight. I'm sorry, except we do have vaccines.
Right. That, Mike, are the vaccines going to be free of charge?
They better be. My understanding, they will be, yes, because the companies basically have already been, pardon the expression, paid for it already.
Yeah.
The feds have already paid at least, the paltry sum of several $1 billion to pay for these 50 cents a shot things, Yep.
Okay. Anybody have any questions for our resident expert? Sorry, Mike. All right.
It's just very hard to listen to every week, isn't it? The numbers.
Yeah. I mean, one of the things that I can't remember what there was one statistic. It was, I think the positivity, it went up like to 5,000, or maybe it was tests a day. Never mind. I can't remember what it was, but all right.
It's out of control. We don't control the virus. All right. Yeah. So, but do whatever you can to get people to not mask, to distance. The town's done a pretty good job considering. All right. If you look at our numbers, I know they're not great, but compared to, for example, Rotten Air and all the rest, when you calculate in their population and everything else, we're not doing that bad, considering how many people come in and out of our town every day. That we can't. It's human nature. Nobody's at fault here except the usual suspects.
Okay.
Janet, that one email that came in, a complaint about Market Basket, I assume Jim will go check that out.
Yeah, I've passed everything along. We had 2 for Market Basket, 1 for Subway, and somewhere else today. So I sent them all to Jim.
Thank you.
Okay. So any questions about more discussion about the COVID update? All right. And Janet, you already talked about the correspondence that Jim will take care of. I wanted to ask Kevin. Kevin, we got that email regarding Harvard's testing.
Oh yeah, the public schools.
Yeah, that's awesome.
Yeah, good for them.
This is the same group that we're trying to get involved with.
I'm not sure where Mr. Fontanella is sort of aiming his sights, but CIC with the pool testing. I guess it might be a funding issue at this point. With whom they want to engage.
For us?
Yeah.
Yeah. I think Anthony is still waiting to hear, trying to get in touch with the people in Wellesley.
Okay.
And I think they have a tentative meeting on January 4th.
That's right. You mentioned that.
Yeah.
The company he wants to contact, I hate to bring up Cambridge. I think they're in Cambridge. It's a particular firm that did the testing in Wellesley, did pool testing.
Is that the Broad Institute? Yeah. Oh, okay. Yeah.
Well, no. It's a particular company. Not the Broad Institute is part of MIT. It's not a company. It's just where a lot of this got started, and how Wellesley and a bunch of other communities that joined in and, shall we say, fed on the information supplied, began doing pilot studies, pilot work for testing. That's what Wellesley did in the pilot test. They're just coming out of their first pilot. They're probably going to go scaling. So Fontanella, I believe, Kevin's got it right, is waiting to hear, along with with the town administrator to have a sit down and see what the numbers look like, and they have to decide, hopefully with consultation, what they want to achieve with the test, because pool testing can and cannot be the same thing as testing for direct detection of the virus. So, but there's nothing wrong with it. Just what are they trying to get? What are they trying to achieve?
Surveillance.
Yeah. And is this anybody or anything that we can send it to Anthony or kind of connect with Anthony to see if this is something that we can do too?
Well, yeah.
No, Kevin, I just got your email. There's a woman's name. This is from.
Oh, Liz.
Yeah.
Yeah, I think that they have the contact info for the CIC folks.
Okay, so this is the same people.
Yeah.
Okay. All right. And then there was another one that I didn't get a chance to read it. It was from Corey.
Yeah, the ginkgo testing. They are offering, I think, a 5-week pilot program for all public schools in the country. However, I don't know that at this point they still have availability.
Mm-hmm.
I got that word from John this afternoon.
Mm-hmm. All right. Sorry, Mike, what were you going to say?
Nothing. Yeah, I just have to make a note that the school, because it involves the school children and their parents and the staff, the only thing that we can offer is access to information, and not basically start, unless they ask for it specifically. They can get input from any number of sources about what are the best objectives to achieve in testing and which tools are the best used to achieve that objective and the numbers and all the rest. So it has to be, they're going to have to run this because they've got to they have to run it through this public school system.
Mm-hmm.
And they're not doing anything that will negatively affect public health. Okay. So the only way they cannot help would be to fail to get a deal going in time to prevent the schools being forced to close for lack of any number of reasons as a result of the spread of COVID. But I think they're going to try to prevent that.
Okay. We also got some correspondence from John regarding the vitamin D. Did you guys, it was a little lengthy and I was not able to read it today. So I don't think we can comment on it. I don't think we can make those kind of recommendations. I think that's up to their people's regular doctors. So Janet says there's a hand up.
Yes, John has his hand up, Lisa.
Okay, John, you need to add your name and your address, please, before you speak. And there's we'll give you a 3-minute time limit.
Yep. Can you hear me?
Mm-hmm.
Okay. Yeah, it's John Kurzwick, 171 Hartwell. Yeah. If you guys didn't have a chance to read through the letter, just at a really high level, what I did is just kind of summarize some points that came actually not from me directly, but from a group of doctors that kind of go into great detail and have reviewed the literature in great detail to really make a strong recommendation that the general public really needs to make sure that they maintain vitamin D levels. And what I guess in my letter, what I was trying to get across is that, this isn't a medical recommendation. The NIH and the Endocrine Society, they both have limits for what they consider deficient or insufficient levels of vitamin D. So, my proposal really is that we should alert our citizens that, this is correlating well with people that are having the most challenge or complications related to COVID-19. And so what I did, I kind of went through that literature. I also kind of made some points about, the current strategy really relies almost completely on avoidance of the virus, and that's well and good, but it has its limitations, and we're seeing what those limitations are. So really, we need to put in our public health messaging immune health. We really need to make sure that, and especially since now that the data really is very clear about vitamin D, and I went into some points about that as well, and vitamin D is important for regulating the renin-angiotensin system, and it turns out this particular virus docks into ACE2, which is angiotensin converting enzyme number 2. And so there's a lot of, I guess you would call, biological mechanistic plausibility of why vitamin D might be playing such a direct role in who's having poor health outcomes. So if you look at the last page, what I did was kind of come up with a resolution that kind of goes through these points, and of course it's up to the board for rewording any way they would want. But my proposal would be that so for instance on the Littleton Town website there was a message that said, please continue to social distance and wear a mask and so forth. Whenever we have messages like that, I think we would be well to include messaging about vitamin D, whether or not it's as specific as what I wrote or something looser. But really, this is a very important public health piece of information now. It's not, this isn't esoteric. This isn't loosely tied. I mean, the data is very, very strong. So we need to get the word out.
Okay. All right. Thanks for that information. We're going to have to talk to Jim about that, unless anybody has any comments or questions for John.
Yeah, I've sort of had it up to here today. So I'll just, first of all, the studies that you cited are not studies. That's called metadata analysis. And this particular group is notorious, and they've been debunked more than 5 times by all over the world because they didn't discriminate between junk papers and small studies. There is actually no evidence of a clinical nature that links through clinical trial, blind, properly designed trials that link vitamin D uptake, utilization with anything having to do with COVID. Vitamin D very clearly is a very useful adjunct if it's taken with the advice of a physician for certain people who are otherwise healthy or not. Excuse me for a minute. So I'm afraid that the study you cited or the studies that you referred to, and being an engineer, I can understand that, have actually no standing whatsoever. The second thing is that in contrast to vitamin D and a bunch of other stuff, there has been clinical studies, in fact, more than we can handle, indicating that masking and distancing are quite effective in getting control of and reducing the number of infections that spread through the community. So it's not a cure, it's not a medicine, it basically keeps the number of cases down. That's clinically established. So there's a reason why masking works both ways. It took a while to get that straightened out, but that's crystal clear. And distancing, I think, is still something quite very valuable, even if we have to wait this long for a vaccine. So I would be on the record opposed to bothering Jim Gariffi or posting anything on our website that has anything to do with recommending vitamin D in connection with anything. That's an individual medical decision based on medical findings by a physician with a particular patient. Vitamin D also is very, very helpful if you're out in the sun. Let's put it that way, because we don't make vitamin D. Vitamin D, we have to get it from things that we eat, and it also requires a conversion step in sunlight. So it's in the foods. You'll see it posted, marked in the foods. So vitamin D deficiency is definitely something, if it does occur, if vitamin D supplements are needed, just to repeat, you do it with one does it with their physician on an individual basis.
Correct, I agree. Okay. Any other comments from the board? All right, so, and I think that's all for correspondence that we had. To Janet, right?
Yep, that's it.
Okay,
If nobody has their hands up in the audience.
okay. So we'll move on to approving the minutes for last week's meeting for December 23rd. Can I get someone to make that motion?
I'll make a motion that we approve the minutes as submitted for December 23, 2020.
Can I get a second?
Second that.
Great, thank you. So we'll do a roll call for approval. Kevin Baker,
Kevin Baker, yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin,
Mike Zeldin, yes.
Lisa Flanagan, yes. Okay, move on to member comments. Anybody have a comment? I think we've all kind of spoken a little bit tonight. Okay. And any public comments? And is anybody raising their hands?
John has his hand raised again.
Okay. John, state your name and your address and a 3-minute limit.
Yeah, John Kurzwick, 171 Hartwell. Yeah, Mr. Zeldin, I'm a little disappointed in your response.
Excuse me, John, it's Dr.
this
Zeldin
letter.
to you. It's Dr. Zeldin to you.
Yeah, but I'm
Okay.
a little disappointed because one of the signers to that letter is Dr. Paul Merrick. Dr. Paul Merrick is a highly published critical care physician, by the way, who actually takes care of COVID patients. He was one of the first to call for the use of steroids back in April, well before the recovery trial was complete. So, you know, I'm a little disappointed that we're going to just look at the list of people that signed the letter, whether they have to basically determine whether or not it's valid science. That's disappointing. It's very disappointing to hear people on the Board of Health outright just say, hey, I saw this is debunked. Whenever I hear the word debunked, I immediately think these people are closed-minded. It's not debunked. And by the way, the other person that is on this, a signer of this, is Dr. Swelt. Dr. Swelt is also treats COVID patient, and he does the MedCram series. So he teaches other doctors. So it's very disappointing. I will say that, you know.
So does Dr. Atlas. Remember the good Dr. Atlas?
Please take the time to review the literature. And I'd like you guys maybe at the next board meeting to have an official position on it to say, you know, and you can change the wording, even if it's as simple as, you know, there's a strong link between COVID-19 and worse outcomes, and you should consult your doctor to make sure that you are above minimum sufficiency levels. It's to ignore this information is very similar to the people that said steroids won't work, and then people died until July. So, I mean, we're supposed to be doing our best we can to keep people out of the hospital. We agree with the masks, we agree with the social distancing, but we also have to recognize the majority of cases are occurring in the home. That's where the majority of the transmission is occurring. And so when that occurs, what are you going to do? Tell them to keep wearing masks and stay in separate? It just doesn't work that way. We have to get people to increase their immune health. And Mr. Zeldin, people over the age of 65 are typically low on vitamin D. My recommendation for you is to get your vitamin D levels checked.
Okay, thank you, John.
And can I just make a comment?
Sure.
I correct me if I'm wrong, but it's very low risk to have a vitamin D supplement. Correct?
Right, but Kevin, it's up to you and your doctor. I don't think I mean, you do real estate. Louise is an engineer. We have one doctor on our board, and I don't think it's right for us to make a statement like this. Like I think.
I was just asking a question.
I mean, I take it myself,
Yeah.
because I have been deficient on it, but I don't take it because, I mean, that helps with my immune and the way I feel too. So, I mean, I just take it, but I haven't been taking it just because, I didn't get a chance to read what John sent us. So, and.
Say, Lisa, just so that you know, the other favorite one that used to be of the same crowd that put together this medicine is that if you take one of the first things they tested was the over-the-counter drug that's used to control acid reflux because it has the same site of action. It links on the same side as the virus does. So the first thing they did is they fed people lots of doses of acid reflux, acid reflux drug, and a lot of people got relieved of what little acid reflux they had, but it didn't stop the virus. And it's basically the only thing I can say about vitamin D is at least vitamin D won't basically do too much harm unless you overdo it. And I'll leave it to a doctor to decide what your physician to decide how much that is.
Right. Yeah. Yeah. And then would this, we've already got quite an overwhelmed medical healthcare system, looking for vitamin D tests, and then, will that be overwhelming as it is? So people have to have their vitamin D checked. And would that already overwhelm an already overwhelmed healthcare system too? Just something to think about. Okay, any more public comments at all? Louise, Kevin, Mike, you guys good?
I don't have anything.
Okay. All right, so we're gonna, the next meeting will be January 6th. You won't be here, Janet? Yes. And no public hearings until the 13th, correct? Okay, so it'll just be a COVID update next week. And is Katrina going to be able to come? I forget what week she was just this.
Yeah, I think she's
Yeah, but yeah.
next week.
Okay.
Yeah.
All right. The short one tonight. Anybody have, so that's it. Anyone want to make a motion to adjourn?
Well, I'd like to first of all wish all of you a very, very happy new year. And
Yeah,
I hope next year is less interesting than this one.
correct.
Me too.
But I think it's going to be interesting, but in a different way.
Yeah, who ever thought? I know Louise said, she's like, I never signed up to be a board of health member during a pandemic. Oh, who would have thought that this would happen?
Yeah, right.
Janet and I were talking a little bit before you guys all joined, but I think Louise and Kevin, you guys are up for election this year.
Mhm.
Is that true? So we have 5 months to get your papers in.
Oh,
Yeah. Tough one. Let's see.
Kevin, come on.
Come on, Kevin. All right. So did we get a motion to adjourn? No.
Motion to adjourn.
I'll
Thank
make
you,
a
Mike.
motion to adjourn.
Okay. And thank you, Mike.
Happy New Year.
Thank you for the well wishes. Everybody stay home.
Happy New Year.
Happy New Year. So second.
Second.
Okay. And Kevin Baker,
Kevin Baker, yes.
Louise Nichols,
Louise Nichols, yes.
Mike Zeldin, Dr. Mike Zeldin,
I'll leave that out. Yes, Mike Zeldin, yes.
and Lisa Flanagan, yes. All right. Thanks, guys. Happy New Year.
Bye-bye.
Happy New Year.
Next week.